Welcome to the Informed Pregnancy and Parenting Podcast. I'm Dr. Elliot Berlin, prenatal and family chiropractor, and I'm here with our co-host, Maria Bulin. Maria is a birth and postpartum doula, and she is a blogger at avecmaria.com. Welcome, Maria.
Thank you.
Today we're going to explore the heated and often polarizing topic of childhood vaccination. Maria, you have two small children, and you're constantly in groups of children and mothers. What do you hear on the street? What are people talking about vaccines?
Well, I live in Venice, and currently people aren't talking about very much else in the mama groups. But I'm usually in the more hippie doula and midwife community, and it's a hot button topic. So I hear about it all the time. Do
you hear from people on both sides of the debate, or are you mostly?
I do, and I have a pretty moderate pediatrician, so I do hear some people that are pro-mandate, but for the most part, I would say about 75% of the people that I talk to are not pro people being forced to have their children have vaccines in order to go to school.
Right. But that's a big distinction against being not in favor of a mandate, but maybe they're not against vaccination, or are they also the same families that prefer to not vaccinate or to limit their vaccines?
It's a mix. That's a good question. But at the same time, I do have many friends who have done some vaccines, but not all, and have chosen to elongate the schedule. So I would say that's the bulk of the people that I talk to. But I do have a handful of friends that have chosen not to vaccinate at all, and I would say this community in Los Angeles does lean in that direction to vaccinating less often and sometimes not at all.
Certainly in your holistic circles.
Yes.
I, as a prenatal chiropractor, moms are always asking me, they're concerned, what do we do when the baby comes? Because there's so much noise about the debate right now. And mostly the moms that I talk to are somewhere in the middle. They're not super like, you must have every vaccine today. And they're not super anti-vaccine. They're mostly, I think, hungry for information. And it seems that it's not easy to get level-headed information. So what we want to try to do today is have a conversation about what are vaccines, how do they work, what are the vaccines that we routinely administer and why. And then sort of get into the arguments that stem from there, or the conversations and debates that stem from there. We are very blessed and lucky to have two practicing pediatricians with us today. We have Dr. Carly Wilbur. She's a mother of 5 and practices pediatric and adolescent medicine in Cleveland, Ohio. And she's a strong supporter of preventative care. She's an associate professor at Case Medical School and helps train residents at Rainbow Babies and Children's Hospital. Welcome to the podcast.
Thank you, Elliot.
And we also have Dr. Jay Gordon, who, while completing a residency at Children's Hospital of Los Angeles, took a year to serve as senior fellow in pediatric nutrition at Sloan Kettering Institute of New York City. In addition to treating patients, Dr. Gordon has written several books, including the mistitled recent release, Preventing Autism, What You Can Do to Protect Your Children Before and After Birth. He co-authored Mayim's Vegan Table with Mayim Bialik and wrote the foreword to Alicia Silverstone's Kind Mama. Dr. Gordon writes a regular column for Fit Pregnancy magazine, speaks regularly on topics of pediatric and raising healthy children, and plays soccer 4 days a week while practicing pediatrics 7 days a week. Welcome to the podcast. So what I love is that both of you are actively practicing pediatrics, and I'm sure you address the vaccine questions daily in your practice. And I would love to have this conversation to get deeper insight into childhood vaccinations. As a disclaimer, before we move forward, I want to specify that we're just talking today about data that pertain to the United States primarily. Other countries vary widely in the prevalence of the diseases that we're going to talk about and their approaches to vaccination, and also that our discussion of vaccines should not be taken in any way as medical advice. Any decisions that you make pertaining to vaccination should be made after consulting with your pediatric care provider. So if we can start with a little bit of a history of vaccines, this is something that I pulled off of Google, so it must be true. If you could, I'll just read through it, and if you can weigh in if you disagree or agree, but it's sort of a history of how vaccines got started. There's evidence that the Chinese employed smallpox inoculation as early as 1,000 years ago. Modern vaccination began in 1796 with Edward Jenner's use of cowpox material to create immunity to smallpox, which quickly made the practice widespread. Louis Pasteur's 1885 rabies vaccine was the next major milestone, and then antitoxins and vaccines against diphtheria, tetanus, anthrax, cholera, plague, typhoid, and tuberculosis were developed through the 1930s. By 1950s, new methods for growing viruses in the lab led to rapid discoveries, including the creation of vaccines for polio and other common childhood diseases such as measles, mumps, and rubella. In 1980s, children got 23 doses of 7 vaccines. Today, we typically give 69 doses of 16 vaccines for children by first grade. Sound about accurate?
Your numbers sound right.
Seems right. Our audience can, number one, check on Google to make sure I'm right. But also, in addition to Google, if you look at informedpregnancy.com, we are going to have all of the show notes, and every reference that we mention will be linked to its original source. So if we can talk a little bit about how the vaccines work. What is a vaccine, and how does it work? Dr. J, maybe you can start us off.
Vaccine fools the immune system into believing it's been exposed to a certain disease, either through killed bacterial fragments or live or attenuated, almost killed viral fragments, and the immune system responds with antibodies, very simply. And the body, without being exposed to the disease, the immune system creates a protective level of antibodies against these diseases.
Okay. How does that correlate to how your body naturally fights off a disease?
You get all the benefit of the immunity, your body having the experience with the weakened form of the germ being inoculated, and then you don't actually have to suffer the symptoms of the illness.
So normally I would be exposed to a virus or a bacteria through various means, through air or through contact, depending on which one. Then my body would recognize that as foreign, and my body would naturally make antibodies to it. But you're saying it would make me sick.
More so than just foreign, dangerous. There are lots of foreign things that the body is exposed to that it doesn't create antibodies against because it doesn't register to the immune system as being a threat.
So if it doesn't register as a threat, I won't fight it off?
You'll still produce antibodies against certain things, but if it doesn't register, if it doesn't register as a threat, there's a different type of response. And vaccines were invented when there was a very clear risk-benefit analysis. I mean, the smallpox, for instance, as you mentioned. I mean, the disease was just, I don't remember the case fatality rate, but it was incredibly high. Polio, a disease that occurred so widespread that it threatened whole countries in the 40s, 50s, and so on. And there was a clear benefit to whatever risk was involved in vaccination. As there is with any medical intervention, there's always a risk. But there was no question at the time about smallpox or polio. So, actually, that's not true. As you may know, smallpox was questioned like crazy. There were anti-vaccinationists when the smallpox vaccine was invented.
Oh, interesting. What was their argument?
That the vaccine was really dangerous. It was not a purified vaccine. I mean, they scratched the daylights out of your arm and put in live cowpox, and it created a lot of immunity. It killed some people.
I recall there was, with polio, it seemed to be a similar incident where in the early days of polio vaccine, we used to use a live virus, and that children, in fact, got sick from the polio vaccine. They actually contracted polio from the vaccine.
Rarely, but yes. And I think part of the tenet of first do no harm led to the development of the second polio vaccine that came out, which is the shot versus the oral vaccine.
So the oral vaccine is live?
The oral vaccine is the live vaccine. And in about 1 to 2 out of a million cases, it would revert back to an active form of polio, and a previously healthy child through inoculation would get polio. Not saying how severe it was, but that doesn't sync with first do no harm.
Sure.
So the killed polio vaccine is the injected one, and that's the one that we currently use. They no longer make the oral polio vaccine in the United States.
And in an ironic turn of events, now that polio is down to almost zero, I mean, in the year 2015, in the first 7 months, there have been 33 cases of polio on the planet. We now have more paralysis in third world countries caused by the live vaccine. The live vaccine is extremely effective. one of the best vaccines ever invented. Extremely effective, travels well. You can thaw it and refreeze it. It can travel to small villages in Africa, Asia. But we are now down to 0 cases of polio in Africa in 2015. And more kids are experiencing vaccine-related paralysis than polio. So now we're going to have to go from a vaccine that costs almost nothing and is very effective, no matter where you take it, to the killed vaccine, to the much more expensive second polio vaccine, the Salk vaccine,
which is less effective.
It's still it's probably almost as effective, but the oral polio vaccine, the live polio vaccine, which some of us remember as being on sugar cubes and tasting good, created immunity so effectively that there are many people who say you only needed 1 dose of that vaccine and you were immune for life. And again, it could be thawed and refrozen and traveled without. It traveled well.
Didn't it also contribute to herd immunity because there was live virus being shed?
Yeah, it shed it, and which was the danger that you mentioned. I mean, an immunocompromised grandmother changing a diaper, and this was an incredibly rare event. And there are a lot of people who were not thrilled with the loss of the oral polio vaccine in America because it was so effective, it was so well accepted because it wasn't a shot, but. For statistical reasons, it's gone now from the United States, and I think all other countries in the developed world and in the developing nations, we still are using that oral polio vaccine, and we're going to have to switch.
So if I could just recap on how these work. Naturally, if you're exposed to this virus or bacteria, which would be the antigen, you would yourself make antibodies to it that recognize it, that attach to it, and then your body would be able to go and destroy that complex, and that's how we fight off these diseases. But with the vaccine, you inject something similar, either a live or killed version of the same strain of virus or bacteria, and in that way you can continue to make that arsenal and fight it off and be prepared to fight it off should you be exposed again, without suffering the consequences of actually having the disease.
Correct.
Does that seem right?
Yes, for the most part.
Where did I go off?
Well, sometimes speaking to the issue of side effects of vaccines. I mean, after a chickenpox vaccine, a very small number of kids get what looks like a mild case of chickenpox. After a measles vaccine, the same thing can occur. Okay,
so you're just taking issue with the fact that it's not without any symptom, or the possibility of getting sick at all, but you're typically not going to get the full blown illness that you would have had if you were exposed to the virus naturally.
I agree.
Okay, great. If we can move on from there to the current vaccine schedule, the one that's the U.S. schedule that's endorsed by the American Academy of Pediatrics, the CDC, and the American Academy of Family Physicians. I'd love to just go down the list and talk about what each of these diseases would look like if we were to get it, or our children were to get it, the nature of the disease itself, and also speak a little bit to the current incidence of these diseases, and then also talk about the vaccine for that particular disease and how it works, and any potential issues with those vaccines. So if we can start with hepatitis B. What is hepatitis B and how would you get it? I think hepatitis B is that where the vaccine recommendations begin?
In the nursery, correct. So most healthy babies will receive a hepatitis B vaccine in the nursery before they even go home in the first couple of days of life. Hepatitis B is a very highly debated vaccine for people who choose not to vaccinate, or what Maria was saying earlier in terms of people choosing some vaccines and not others. Hepatitis B is one of those vaccines that people feel, because the risk to infants is so small, why are we vaccinating infants at all?
Well, let's back up a little bit before that. How do you get hepatitis B?
Typically, it's through intimate contact with bodily fluids. So IV drug abusers who share needles, or intimate contact like sexual contact. But there is a higher than, I think, recognized rate of household contacts and vertical transmission, up to 35% of cases for babies who are born into a household, or certainly a mother who carries hepatitis B.
Okay.
Hepatitis B can, as you were saying, hepatitis B is transmitted horizontally through sex and drugs. Okay, that's pretty much exclusively it, sharing needles and so on. It used to be, before the blood supply was secure in certain parts of the world, you could get hepatitis B from a transfusion. Hepatitis B is transmitted vertically. I'm motioning with my hand for those of us who are watching on the radio.
Up and down.
It's transmitted from a mother who has hepatitis B to a baby. There are very few mothers in our practices who don't know that they have hepatitis B. There are people who don't get good prenatal care. Hepatitis B is one of the hepatitides. There's A, B, C. There's also delta and gamma. But it's of the three best known, hepatitis A, B, and C. Hepatitis B can be a permanent disease. It can lead to liver damage, liver failure, and liver cancer in an incredibly small percentage of people, but it can happen. We attempted a campaign in the mid-'80s to vaccinate high-risk people, all intravenous drug users and promiscuous heterosexuals and homosexuals.
Yeah,
Please come in.
They didn't
come in.
No.
They didn't come in.
Yeah, it's interesting.
So what happened in the late 80s?
Should have promised some other things as well.
A candy bar. But
Of sorts.
so we decided, who do we have? We have babies. And as a public health measure, there's no question that it's been successful. There's less hepatitis B because of that vaccine. But as Carly was saying, for each individual parent, when they say, what is the benefit to my baby? And the answer is zero at that time. In my opinion, the answer is zero. Because we're going to track you. We're going to give you a hepatitis B vaccine as you get older. We can discuss this with your 9 or 10 or 11-year-old son or daughter, where the risks are, what you are protected from and what you are not protected from. The public health benefits are unquestionable. And that we continue doing that. But each individual parent questions me and questions you, and they say, what is the benefit to my baby? And we have to tell you, we have to be honest with them and say there's no benefit. I mean, to postulate the idea that somewhere at preschool your child's going to have an open wound and a child with active hepatitis B is also going to have an open wound, or that your child is going to pick up a needle on the beach, which does happen, and it's going to have live hepatitis virus. It's postulating a sequence of events which is very, very, very improbable. But as a public health measure, it works.
Is there a known downside to the vaccine itself? Are there side effects to it?
Small.
Basically risk-free. That needle scenario actually is not impossible. My daughter and her friend, whose father is a physician, picked up a needle on the bus one day and started playing with the tip going, ooh, that's so sharp.
Sure. I've had that happen also.
Yes.
I've seen people, I've read stories about needles in the movie theater.
But as far as the risk, the problem that I have with my point of view about vaccines is that I look at case reports, I look at what I wouldn't consider to be obscure journals, a journal of neurology and so on, and they show that obviously every time that we do something, whether it's a hepatitis B vaccine or give you acetaminophen, there's a small risk involved. Now, the risk involved in giving the hepatitis B vaccine is probably not 1%. I mean, that would be a tremendous overstatement to say a 1% risk of some disease occurring after the vaccine. But there's a risk involved every time we do something. And I would explain to parents, as I know you do, that the risk involved in giving that vaccine is 0 to none.
Minuscule.
But then the question that they ask is, what's the benefit?
So, I mean, from the way you both described it, it sounds to me, I'm just processing, maybe you can weigh in, Maria, also. It sounds to me like you're saying pretty much zero risk, pretty much zero benefit for the individual child.
I don't know about zero benefit, because the people who are at risk for hepatitis B are not people necessarily who do a lot of preventative, think ahead kind of planning. So
At risk at what point in their life?
As adolescents.
But I'm just talking about, you said we give it at the hospital before they even leave the hospital. So at that moment for that child, for the individual child, it seems to me like there's almost no risk and almost no benefit at that time. If you're projecting later, if we don't get them now, they may be at risk later.
They may. I feel there's an issue of capture, because the healthy kids don't necessarily come back. I have plenty of kids who see me all the time, and then all of a sudden I'll get a notice from the Minute Clinic that they went there for their annual exam on a Tuesday at 3:00. We're open.
But you're talking about a specific class of patient, but there's certainly another class of patient who's very on top of their healthcare, and for them who would be tracking it and would vaccinate later, it doesn't seem like there's a risk in waiting for them.
You're saying there's no urgency for the vaccine.
There's no urgency to give the vaccine before you leave the hospital for that group of people.
But so in 1981, when the vaccine was developed and we couldn't get the high-risk patients to line up for the vaccine.
Yes.
Because they didn't want to come forward and say, yeah, that's me. I'm the IV drug abuser. I'm the person who's having unprotected sex. So how is it, when you look at the statistics, the disease incidence only went down when we started to vaccinate infants?
But I'm again just talking about that individual child.
That's the problem, because neither of us disagree that from a public health point of view, this has decreased the incidence of hepatitis
Absolutely.
B.
It's the
so
only
that if we
thing
change
that's worked.
back and if we said that, well, there'll be no more hepatitis B vaccines given at birth, chances are very good the incidence of hepatitis B is going to rise.
Yes.
People will be in danger. There'll be deadly cases of hepatitis B, no question.
Yes.
But the question
the
that
child's
I
on
get
a
asked...
continuum. It doesn't have to do with right that second. All the vaccines are preventative. You want to get the protection in before they become a promiscuous teenager.
As I think we go down the list, we'll see that children are at greater risk as infants for some of these diseases than for hepatitis B. And I'm not...
But it's not zero risk for hepatitis B as an infant.
Zero risk. It's not zero risk, and
it's not zero risk to contract hepatitis B.
There's not zero risk from taking the vaccine.
Well, I would just to make it a little bit personal, because between the two of us, we have children, and you have more than I, certainly. But for our individual children, the risk of contracting hepatitis B was zero.
I don't know. My daughter was playing with a needle on the bus.
But if she had been exposed, okay,
as a newborn,
but as a newborn. In other words, if someone said, "I really don't like that vaccine. I'd like to wait till he's a year old."
As a newborn, and when she was a newborn, I was a resident. I was working 100 hours a week. I had a nanny who I trusted with her, but if they went to the park and she found something and touched it, I don't know. Like not a newborn, a toddler. But it's not. I don't believe the risk is zero.
But for the newborn with parents that know they don't have the disease.
I'm going to go out and say the risk of almost anything is not zero.
Right.
Everything has some risk involved in it. But if it's very close to zero, it seems like from an individual child perspective, their parents might choose to wait and not really be taking an unreasonable risk for that child. I'm not downplaying the potential benefit to society. I'm just saying I like to look at it from both sides.
Yes.
What is best for my individual child, and then social responsibility after that, or even individual responsibility. Maybe I'm safe for 3 months or 6 months or 9 months, but then my kid goes to the park and plays with a needle. I might be at risk at that point.
And we can even delineate the choice of having it at the hospital when the baby's a newborn and delaying it to their first appointment, for example, when they're a few weeks old. I mean, so there are differences between doing it as a newborn and 10 years old. Yeah. And you can also, if there is a choice, you can also choose to not have it at the hospital and wait for a time that your healthcare provider deems okay. So that we knew going into the hospital, we didn't want our firstborn, who was born at the hospital, the second was not, to have it. And so we didn't know how long at the time. I had done some research, but we knew for sure as a newborn that we did not want her to have that.
And I think that's what I hear from a lot of our patients is that many of them would administer these vaccines, but they're a little nervous because it just seems so much right up at the beginning, which is, we'll talk about resources later, but I think that's where Bob Sears' book came in. And
I'm so glad you mentioned that, because I have a quote from Dr. Sears' book about this particular vaccine.
Perfect.
So about hepatitis B vaccine, Dr. Sears says, quote, "This is an important vaccine from a public health standpoint, but it's not as critical from an individual point of view." That's the end of the quote. Explain to me who makes up the public if not the individuals. How can that be? I don't see how that works.
You're questioning his quote?
I'm questioning, I agree with the statement that it is, I guess I agree with his actual wording that and this is what Dr. Gordon said earlier, as a public health standpoint, getting people immunized fully and early for this vaccine is important because, as evidence has shown, it's the only thing that's changed the incidence and made it come down for this particular germ, the hepatitis B. So how can you say this is good for everybody, but not you, ma'am, not you, sir?
Well, just to mention another quote that I like a lot, Most vaccines are given at an early age because that's simply when children are most vulnerable to infectious diseases and need the added protection. Although some may call it a one-size-fits-all approach, the recommended vaccine schedule is flexible, and it does account for instances when a child should receive a recommended vaccine or when a recommended vaccine should be delayed. These decisions, however, are best made in consultation with the child's doctor, and parents shouldn't be reluctant to have such discussions. This is not a quote from Bob Sears. This is a quote from Rear Admiral Dr. Ann Schuchat, who is Assistant Attorney General and the director of the CDC's National Center for Infectious Diseases. And she, in an official CDC memo, said the vaccine schedule should be flexible, which is absolutely anathema to virtually every pediatrician that we know. Now, Ann Schuchat is, one of the biggest of the big. Okay, she's one of the most authoritative physicians in her discussions about vaccines and is not flexible about other things. But this particular vaccine opens up, and you didn't mean to do this right at the very beginning of this discussion.
Oh, no, I did not.
Doctor, but it opens up the whole issue. What happens if parents get a vaccine at a time when they either weren't expecting it, which I think they should have been, we should have told them, or they don't feel it's the right time for their child, but somebody pushes them very hard? I think we're liable to lose some of our credibility in our discussions of other vaccines, other healthcare issues, but certainly other vaccines. And that's one of the reasons that I if somebody really wants a hepatitis B vaccination at birth, that's fine with me, because I don't think that there's a great risk to that vaccine. I don't think risks are intrinsic to each and every individual vaccine. I don't like the schedule at all, not at all. But I think that overstating the risk of that vaccine, my pulling out and cherry picking little references, the journal Neurology showing an increased incidence of multiple sclerosis after the hepatitis B vaccine, how much? 1%? No. 0.01%? A lot closer. Okay, so trying to scare people out of getting that vaccine is really, I think, incorrect and a little bit unethical. But trying to scare them into getting the vaccine is the same. I think it should be presented to them, and instead the vaccine schedule is presented by most pediatricians as if it's etched in stone.
Yeah.
And I think that we lose people when we do that.
From my conversations daily with our patients, most of whom are not very pro or very anti-vaccine, but looking for information, they want to be a part of the decision making. They want to have research. They want to know what the risks are to their child and what the benefits are to their child first, and then also understand the public health issue second. So I think they're both important to them. But if you tell them sometimes that even though there is no clear benefit to your child in getting this vaccine, now we are going to make you do it anyway, they run away from that. They don't want to. I
would never vaccinate without a parent's consent. Absolutely not.
The state of California just decided to. But
I disagree with that too. I think the statement was that they can't attend public school.
They pretty much
can't attend school,
any school,
private school, public school, daycare.
Well, then the parents are faced with a choice. It's not.
Well, if you don't consider that forcing them to vaccinate, I mean, it's a pretty hefty choice.
It's real hot here now. Because no matter. I mean, Elliot, I believe you even misspoke yourself a little bit at the beginning when you talked about both sides of the issue. There's not both. As you know, there aren't two sides to the issue. There are those of us who get vaccines, give vaccines every day. Before I left for Nepal, I got a hepatitis A vaccine and a typhoid vaccine. I'm still not clear why I got those.
You look great.
Thank you very much. I survived them. But there are those of us who just would like to do this differently, and who I don't believe in coercion. I believe in if I got a product to sell you, I better be able to present the facts and convince you that this product is worth buying, because we're not giving these things away, we're selling them. The product is worth buying, and that the risks outweigh the benefits. And I think that if you give parents this stone wall, because if you want your child to attend school, period, private, again, right from daycare, you now have to get full vaccination in the state of California. And it was misguided. It was misguided. I
It
think
takes away the right to to any kind of education in a group setting.
But we just started talking about one vaccine. We've got 20
gonna
more vaccines to talk about.
I'm just saying that is, I think most people would consider that being strong-armed into vaccinating, not being really given a choice of vaccine. We will talk about that heavily at the end.
Okay.
I'm going to jump over to the next vaccine on my list, which is rotavirus, and I think we can move through them at a pretty quick pace. This
doesn't move quickly, and you know it.
Well, moderate. What I'm looking for is really, what I'd love to do is have an analysis of what is this disease, what would happen if you got it, what is the vaccine like, are there any minuses to not getting it or to getting it at a certain time as an individual and then as a society, and then save the debate for, individual choice versus societal responsibility for the end. And we can talk about all the vaccines in that arena as well.
Rotavirus is one of the nastiest viral diarrheas that a baby or a child or an adult can get. The vaccine, and we now have I believe we're now on our second and third iterations of the vaccine, probably a lot more than that. It's a vaccine that would save hundreds of thousands of lives in Africa, certain parts of Asia. Unfortunately, the cost of the vaccine, I believe, exceeds the per capita income in Somalia, the annual income. So the vaccine isn't making it to where it belongs. Instead, it's been given to American breastfed children, leading to one of the worst recommendations I've ever seen regarding vaccines, which is that mothers should withhold breastfeeding for a period of time surrounding the rotavirus vaccine, which endangers a child more. The vaccine is okay. Again, it's a vaccine with very little benefit for American children, in my point of view, but it's not a dangerous vaccine. It was written up. It's been written up for years and years and years as increasing the incidence of intussusception, which is a dangerous obstruction in babies. But most of the medical literature,
digestive system,
excuse me, a blockage in the intestinal system, intestinal tract rather. But most experts feel that it doesn't increase the incidence of intussusception. If it does, it's a minuscule amount, and that the vaccine is worth it. I disagree.
Thoughts?
As recently as a decade and a half ago, when I was doing my residency at the Cleveland Clinic, from October, November until April, you could smell the rotavirus when you came to work. There was a whole wing in the baby section of the inpatient hospital that just reeked. The poop smells like vomit. The vomit smells like poop. It's 2 weeks of fever and just leaking from everywhere.
That's a poetic statement about rotavirus. That's really great.
It was disgusting. I'm sorry to use clinical terms. It was nasty. It was just nasty. And, as the residents, we all got it too, because you come anywhere near a kid with rotavirus and you're going to get rotavirus. I was actually comforting a family in my office once. The dad was cradling his 3-year-old in his arms. And I said, "Where's the rest of you guys?" And the mom's in the emergency room because she and the 9-year-old both needed to go from dehydration. And I said, I'm like stroking the child's hair and I feel something. I'm like, "Oh, what you got in there?" And the dad's like, "Probably my puke." I'm like, "Wow, this is really disgusting." Sorry to revisit the word. But yeah, so
I think
rotavirus.
Last time you said nasty.
It was nasty. Yeah. Rotavirus is brutal. It is virulent. If you, like I said, you come near it, you catch it, it spreads like wildfire through daycares, through households, through wherever you go. When you were saying the different iterations of the vaccine, Dr. Gordon, it's true. The previous, not the current Rotatech vaccine, but previous versions of the vaccine were withdrawn because in post-marketing studies, they did see even that minuscule risk, and it's just not worth it. So they came up with a different version of it. There's no, immediate pain to the child because it's an oral vaccine and they eat it up. They are happy to have it because it's delicious. And the opposite of nasty. The last case of rotavirus that I've seen was 3 years ago, and it was in a child who had older teenage siblings. And with this child, the mom heard something on Oprah and decided she didn't want any vaccines for the child. She told me that was her rationale because Oprah said. And so she refused the rotavirus vaccine. And this child got so sick. She had acute kidney injury. She was in the hospital for 2 weeks. She got so dehydrated. She was really, really sick as dirt. And it's a shame because it was entirely preventable with something that caused her no pain, no harm.
By what mechanism does rotavirus spread?
Fecal oral. It is unwashed hands from in a daycare or in a family where mom or the caregiver or anyone has been changing a diaper, or someone in a restaurant hasn't washed their hands after returning from the restroom, and then they handle the food, or somehow that it gets into the child's mouth.
So prevented by good hand washing technique.
Absolutely. Which I would love to see go viral.
So again, it seems like in certain environments, their kids are at much greater risk than in other environments.
If you eat in a restaurant, because even if your
Who
infant
eats in a restaurant? If the adult or the baby?
Yes. Well, but even if the parent is the one eating in the restaurant and the child is too young to eat food, still it can come into the house that way, and then the child is absolutely at risk.
Even if the parents are good with hand washing.
It's explosive diarrhea.
And then what about, Dr. Gordon, you mentioned the recommendation to hold off on breastfeeding.
There was, an ill-advised recommendation to be careful about breast milk killing the rotavirus vaccine. And it was if it hasn't been completely withdrawn, it certainly is being ignored by any good doctor. You don't stop a mother from breastfeeding because of a vaccine. You don't interrupt it for an hour because of a vaccine. That puts a child at greater risk.
You guys seem to be in agreement.
Agreed. Absolutely agreed. I never even heard of that. I'm sorry.
Oh, it was out there.
Is
never said that.
Is rotavirus something that, with enough vaccination from the societal perspective, that will go away?
Ooh, that's a good question.
I think it's still one of those. It's a plane
probably
right
not.
away. Yeah.
Well, I've only seen one serious case of rotavirus. I shouldn't say that. I'm sure I've seen dozens and dozens and dozens of serious cases of rotavirus. But I saw it in a 9-day-old baby. I saw a 9-day-old baby with a fever, and who looked just like she had meningitis. And she was hospitalized, and the most surprising finding was that the cause of all of this was rotavirus. Now, that's a case that probably couldn't have been prevented no matter what, although I don't know. She might have been in contact with somebody's toddler. I don't like the vaccine at all. I think that the again, whatever incredibly small risk there is not outweighed by the benefit to healthy American children. It's almost an elitist point of view. I wish that the vaccine would be shipped to where it would do the most good, because here, if you get diarrhea, even if you get dehydrated, you get plugged into intravenous fluids and you can be saved. There is still there's an estimate of fatal cases of rotavirus. I'm not sure that I believe that it really could cause that much harm to a healthy breastfeeding baby. But
so, if I can recap, and correct me if I'm wrong, it sounds like if you get rotavirus, if a baby gets rotavirus, it could be both incredibly uncomfortable and also knock them down a bit. Dehydration, pain and other digestive discomfort, but they are very unlikely to die from rotavirus.
In the U.S., yeah.
In the U.S., and especially it sounds like if they're breastfed and also living, at home rather than going to a daycare situation.
Right.
But that the current version of the vaccine doesn't really seem to have any particular significant side effects.
Agreed. I feel it's safe.
That's exactly the way I feel. It's not a dangerous vaccine.
Just in terms of rotavirus, is it just babies who are susceptible to it, or it's
to
not?
the germ?
Don't
heck no.
But don't they stop?
It's medical residents
anyone who
too.
comes into contact with them.
But
It's
if you
medical,
didn't
yeah.
receive it by the age of 6 months, from what I've heard, you don't need to get it after the age of 6 months.
The rotavirus vaccine.
The vaccine.
I don't know when. There's a point where we do stop giving it, and I can't tell you exactly when it is. But the reason it's given so early, as the CDC's Dr. Schuckert said, is that kids are vulnerable to these diseases
It's
early, and
dangerous early.
the reason that people give, the reason that there is such dislike and disdain for delayed vaccine schedules is that, admittedly, there's no child at higher risk from contracting pertussis than a child in those first 2 or 3 or 4 months of life. There's no child at higher risk to injury from rotavirus than that very young child. But my thought is that the risk is overstated and that we're coercing people too much.
Maria, I think you're right about the 6 months. I know that if a baby comes late for their 6-month visit, we don't give that third rotavirus dose. I always thought it was because insurance wouldn't pay for it because it was outside the recommended time frame.
Let's move on to diphtheria, tetanus, and pertussis. It's a triple vaccine. There's DTaP and Tdap, for one thing that's a little confusing. But if we can talk about each of the 3 childhood illnesses that we are trying to protect children against, diphtheria, tetanus, and pertussis. First of all, why are they together?
They like each other.
They behave well?
They do. They do.
As a vaccine?
They do. Indeed, they do. The diphtheria
Why are they
and
together?
tetanus. Well, even when you give the DT booster for kids over 7, when you don't need the pertussis, if it's a different situation, then the diphtheria and the tetanus are together. I think the diphtheria doesn't take without the tetanus.
The diphtheria went in a long time ago. I mean, I saw one of the last cases of diphtheria in America at Children's Hospital in the late 70s at one of the boat people. Remember the boat people in the late 70s coming across from some part of Asia? You don't remember? It was before you were born. I forgot. It was before you were born. And there was no humor because it ended up being a fatal case of diphtheria. The child did not get the antitoxin in time. But the diphtheria goes along for the ride. I believe that it is supposed to kickstart the immune system to cause the immune system to react more strongly to the tetanus and whooping cough components of the vaccine.
What is diphtheria? What is the disease?
It is a bacterial illness which creates a web in the back of the throat, an obstruction, inflammation in the back of the throat. It's a tonsillitis from hell, and it can then progress from there to attack the heart. Oh. And unless the disease is neutralized, that is the cause of death.
How does it spread?
It's a person-to-person contact. It's a disease that's pretty much gone from the entire planet, but there are still little outbreaks. It requires a pretty serious breakdown in healthcare and healthcare infrastructure and hygiene in order for it to spread. We don't have a lot of outbreaks. I'm not even familiar with the latest outbreak, and I know there has been one in the past few years.
Is it treatable if you recognize that you...
There's an antitoxin. There's a
after the fact.
After the fact, you can neutralize the bacterial toxin.
I always wonder with things that are on their way out like this, and we have younger doctors come in, are they even able to diagnose these diseases that they've never seen?
Oh, diphtheria has to be just the worst exudate in the back. I mean, I've seen pictures, I've researched for vaccine talks before, and I've never seen a case, and I hope to never see a case.
You never will see a case. But it's still part of the vaccine. We can't change that vaccine because in order to change that vaccine, they would have to go through $1 billion worth of trials to get a brand new pertussis tetanus vaccine.
So diphtheria pretty much is in there.
Goes along for the ride.
To help the other two be more effective. Tetanus is from the soil. Is that true? Am I making that up?
It's an anaerobic bacteria. Oxygen kills it. So classically, you find it in the garden where there's no oxygen. You can find it in the center of a piece of horse manure because there's no oxygen. And the classic infection is a nail puncture where a nail enters the foot, creates a deep wound. The nail was contaminated with Clostridium tetani, and it plants that bacteria, and then that puncture wound closes quickly, and you now have an inoculum of tetanus in an oxygen-free environment.
Your body.
It's an extremely rare illness in America. It is not a rare illness in the third world.
Why is it rare here?
Because we vaccinate.
We've got a extremely high vaccination rate against tetanus.
Would it otherwise? But it doesn't spread from person to person.
Right, it doesn't. But wounds are very common. I mean, the children and adults get unusual wounds often. I mean, perhaps not as often in my office as you might see when people are working on a farm, but virtually everybody has a tetanus shot.
Are you saying that if you have a wound and I have a wound and we're both not vaccinated?
No.
You're not saying that. You're just saying wounds are common, so the tetanus coming out of where it's soil or the nail or wherever it is.
You keep opening up an interesting controversy.
What's that?
The state law in California, the new one, and state laws elsewhere mandating vaccines against transmissible illnesses includes tetanus, which, as you've just mentioned, is not.
Well, because it's bundled with pertussis, which is.
Right, but it's specifically listed in the California state law, and I'll bet it's listed in New York state law and others that you have to have tetanus immunity before you go to school. Because what I've always wanted, I would love separate vaccines. It's been a long time since the University of Michigan stopped making. They had a single pertussis vaccine for a long time. It was a whole cell pertussis vaccine, which is a topic for some other point, I guess, perhaps this evening. But they made a P, not a DPT or a TDP or anything else, just a P.
Just a P.
And it was fairly useful because there were people who had all their tetanus shots, didn't need another tetanus shot for 5 or 10 years, but they wanted more whooping cough immunity. But they stopped manufacturing that vaccine. I'd love to see them start making a pertussis vaccine again.
Just theoretically, if there was a tetanus vaccine by itself, right?
Tetanus vaccine.
Tetanus.
There is.
There is tetanus by itself.
I had tetanus when I was a teenager.
Oh, you're saying there's no pertussis by itself.
Right, there's no pertussis by itself.
In order to get pertussis, you have to get tetanus.
Right, and the tetanus vaccine, by the way, the single the tetanus vaccine is one of the few places where you can still get a good dose of mercury, of thimerosal. It's one of the few vaccines that still has a mercury-containing preservative.
A tetanus by itself vaccine,
which most doctors don't carry in their offices. If you find that in the emergency room.
So if I'm exposed to tetanus, can I treat that after the fact?
Yes.
Sure can. You can get what's called a tetanus immune globulin, hypertet, because you can't wait for the antibodies to be formed in response to a vaccine because you may have been exposed to tetanus. So you get an injection of a gamma globulin and a tetanus shot, and I don't know if it's 100% effective. I don't know if it's very, very effective.
Okay, so
but it's also pretty inconvenient to bring your child in.
So far,
you also have to be aware that you've gotten a dirty wound and that you're at risk, and you have to be able to get to a healthcare facility that stocks.
How much time do you have?
How much time do you have?
72 hours, I think
3 days?
Is what people say. 72 hours. I don't know if somebody made that number up or if it's a real number.
I wouldn't want to test it.
But there is
But it just seems right now we have DTaP, which is a trio vaccine. You get 3 things in there. Diphtheria is just to make the other ones more effective. Tetanus, you could potentially treat after the fact. And then there's pertussis, which is why I assume most people are getting this vaccine. What is pertussis?
Pertussis is mean. Pertussis is a very aggressive, prolonged cough. It's nicknamed the 100-day cough. It's a bacterial illness, and even if you get treated, you can still have symptoms for months. I had pertussis. I would not wish it on my worst enemy.
When did you have it?
When did I have it? As a resident.
Oh, so were you not vaccinated?
But you were fully vaccinated.
I was. It's not a perfect vaccine.
So you had a 100-day cough?
They were teasing me that they thought I had tuberculosis. Yes, it is. It's just this horrible cough and just coughing. A lot of my patients, if they get symptoms of cough until they pass out or cough until they throw up, I start to think about pertussis. It's this terrible, choking, awful. My husband teased me. He spit on his hand and made like a catcher. I'm like, what are you doing? He goes, I'm going to catch your lungs because it just sounded like I was going to cough them out. It was horrible.
Is it life-threatening?
It can be.
For adults and children?
For children, it's worse. For little babies who don't have the musculature and the wherewithal in their thorax and their chest cavity to really produce a cough, they suffocate when they get this. There is available on YouTube videos of babies with pertussis, and it's heart-wrenching to watch them gasp and just beg for air, and they can't get it in.
It's a bacteria?
It is.
So do we vaccinate the baby or do we vaccinate the parents?
Well, interestingly, they say that about 80% of the time when babies get pertussis is from a household contact, either an adult whose immunity has waned or a teenager who hasn't gotten there. This is why the DTaP was made into a vaccine called Adacel, which is for teenagers, because the immunity wanes.
And the problem that vaccine has created, and it was discovered after the fact, was that even if you get, grandparents are supposed to be vaccinated to protect the new grandchild, and parents are supposed to get the vaccine, and mothers are supposed to get vaccinated while they're pregnant to protect the baby, to cocoon the baby. But what they discovered was that adults and children who had received the Pertussis vaccine, whether it was the adult or the childhood version, did not get whooping cough when exposed, but carried it at exactly the same rate. So in some ways, that makes them a little more dangerous, because if the grandfather is coughing and overtly ill, you're going to keep him away from the baby. But if he's had the Adacel vaccine, which I think it's a brand name, we're kind of advertising here. If the grandfather's had the Adacel and he's exposed to whooping cough, he won't get whooping cough, but he could carry whooping cough. Now, the solution, again, is a lot of hand washing, except you can have what's known as nasal carriage of pertussis. So we got a real problem with whooping cough. Again,
describe what that is.
Where you're carrying the bacteria in your nose or in your nose.
And so if I sneeze, I can give it to somebody else?
You could give it to the baby. With the vaccines that we have now, the acellular vaccine, the latest and greatest vaccines, we will not only never eradicate whooping cough, we'll never come close to eradicating whooping cough. I mean, you're probably very familiar with the history. We had a whole cell vaccine. It was called the DPT. What it was a vaccine with 2,000 or 3,000 antigens. We sort of just chopped up the bacteria and injected it into your child, and it worked great. It produced a high level of antibodies. It also, unfortunately, produced seizures and brain damage and death in a small percentage of babies. So the vaccine became very much unacceptable because it deterred people from getting other vaccines. I mean, they extrapolated this horrible side effect from the DPT, and they decided they didn't want any vaccines. So we replaced that vaccine with an acellular vaccine, which I believe has not 2,000 or 3,000, but 3 or 4 antigens. So we now have a very wimpy whooping cough vaccine, which wears off, immunity wanes over 2 to 4 years. So we have a whole bunch of people who've had the full complement of vaccinations who 2 or 3 or 4 years later are no longer immune, are capable of catching the disease, carrying the disease. So we need a new vaccine. And one of the reasons that we're not getting a new vaccine, why there's not a lot of money being spent on developing a good flu vaccine or a good pertussis vaccine, is that we tell people we got a really good vaccine. And the real experts, the real ethical experts, have said we've got to stop telling people what a good flu shot we have. We've got to stop telling people that we have a really good whooping cough vaccine. We got a flu shot and we got a whooping cough vaccine, but they're not good enough.
How long have we had the current vaccine?
The acellular vaccine, it's been around for a few decades. I mean, it was used in Germany and Japan before it made it over here. It was used for 10 years in Germany and Japan before it made it to America. But we started using that. Is it 99 that we started using the acellular?
So. The original was from the 1940s.
Yeah, the acellular vaccine's been around for 15 years anyway. Maybe longer.
Do you, Dr. Wilbur, does Dr. Gordon mention something that's whirling through my mind? When it comes to giving the pertussis vaccine, which would be part of the trio of vaccines, to the parents and grandparents, do you agree with that? That it could prevent them from being symptomatic but still be carriers with it? Is there a concern there?
My understanding of nasal carriage is that the bacterial load or the viral load of the germ that you're carrying is not heavy enough to be an infection. It is a colonization. And while, yes, that's an issue we see from methicillin-resistant Staph aureus, that families can carry it, and certainly given an opportunity, it will show it's evil. But I do recommend that the pertussis protection for that exact cocooning effect for my patients.
You're recommending that the people around them get it to protect them.
I do.
And your feeling is that even though they may still carry it, they will not likely carry it in levels that will transmit it to the baby.
Well, this is again like that hand washing discussion. I mean, please don't sneeze directly on the baby. turn if you can.
Sometimes you have no
Absolutely, it
warning.
can't be avoided, and that's why you have to make sure that the baby's as protected as possible too.
And when it comes to the pertussis, well, what's the difference between DTaP and Tdap?
The DTaP is a big D, big T, little a, big P. So
Right.
it's a decent dose of the diphtheria, tetanus, and an acellular. That's the A, pertussis.
Okay.
That's the DTaP. The Tdap is a big T, a little baby D. It's just a whiff of diphtheria to make it work, and then the big P. Also acellular.
But who gets which one?
The teenagers don't need as much diphtheria
Oh, that's
protection.
the one we were talking
So
about before. Okay. Are there downsides to the DTaP?
It's a little P.
Little P.
Little P.
I'm so sorry.
Go for it. You wanna
Tdap. So it's a
They reduce the pertussis. The pertussis component is reduced, antigenically reduced also, because that's the reason that we couldn't give the Tdap, the reason we couldn't give the DTaP, okay, big D, big T, big P, over age 6, was that there were more side effects, and they were not severe or they were, I guess that's a parent's point of view, the doctor's point of view, and a parent's point of view might be otherwise. There were more swollen legs, more painful muscle sequelae. And there were more kids who had fevers. The older that you got, when we tried giving that to older kids, they just had reactions that were unacceptable. So we stopped at age 6, which created a problem, because we know that 7, 8, 9, 10-year-old kids, if you want them to be protected against whooping cough and whooping cough outbreaks, they need vaccines. But we didn't have one. So they invented a vaccine to try to fill that gap, the Adacel, the one with a smaller diphtheria component, a smaller pertussis component. But we still have that few-year gap where we have waning immunity, and we just don't have it right. We just don't have it right. We had after the introduction of some of the newer vaccines, we actually had years where we had more pertussis than before. And the reason is we've got a wimpy vaccine. It really needs to be replaced.
and that weakened one, is that the same one we give to adults?
Yeah, it's weakened from the old DPT, which was just a vaccine that was unacceptable because of the side effects.
Okay.
But a very good vaccine in terms of immunity. Not dissimilar to the discussion of the oral polio vaccine, a vaccine that worked great but had statistically unacceptable side effects.
Are there side effects or risks that are commonly associated with the current DTaP or
Hurts.
Tdap?
You ever get it? You remember getting your last tetanus shot? Most people do. It hurts.
Oh, it's painful.
It hurts.
Other than that,
Very few side effects. I mean, that's how I can sell that vaccine with a clear conscience. I can say, look, getting the DTaP or the Tdap will give you very few side effects, or put it this way, conventionally acknowledged side effects. I rarely see a fever. I've never seen a convulsion after that vaccine. But the thing that makes me a little bit embarrassed about selling that vaccine is to have to tell people that it's probably not much more than 80% effective, and the immunity wanes probably in 3 years.
and you'd rather give them just a P if they only
I'd
wanted
rather
a P.
have
option.
we need a new vaccine. We went from 2,000 or 3,000 antigens down to 3 or 4 antigens. You can see that the immune system is going to respond completely differently. And now, another, again, interesting sidebar is that we have a serious percentage of pertussis bacteria, I believe it's up to 20%, that are what's known as pertactin negative. They are eluding the vaccine.
The vaccine's not effective on them.
The vaccine is not effective against a significant percentage of whooping cough. So,
Which is why you were fully vaccinated and
Got sick anyway.
got sick.
yeah,
again.
which may have been more due to the fact that immunity
It
wanes,
waned.
and you can't get that vaccine every year. Although there are some people who are recommending an Adacel booster every year.
Do you see, Dr. Wilbur, the benefit of having just a P?
I suppose this is what happened with the MMR when it got picked apart. And they don't make individual measles, mumps, and rubella vaccines anymore. The problem is it's hard enough. I mean, in your beginning introduction, you were talking about the numbers of vaccines, the numbers of shots, the numbers of diseases. If it's difficult to convince a parent that you need to get, a certain number of DTaps, if they're split up into different ones, then we have the discussion. Do we really need the diphtheria? I mean,
but isn't that the discussion that they want to be having?
I mean, yes,
they want to make choices for each individual disease, each individual vaccine, and each individual child. And with that, let's take a break to absorb all this information. I invite our guests, Dr. Wilbur and Dr. Gordon, and our listeners to join us for part 2 of the Facts About the Vax on the Informed Pregnancy and Parenting podcast. I'm Dr. Elliot Berlin. Please visit informedpregnancy.com for show notes with valuable information, references, and resources pertaining to this podcast. And as always, write to info@informedpregnancy.com with questions or comments.